Thank you. Hi, this is my first time in INSU, and it's been really great, and I'm just thrilled to be here. So today I'm going to talk to you a little bit about the dual public health crisis that Canada went through with the COVID-19 pandemic and our ongoing drug poisoning epidemic, and specifically the experiences of supervised consumption sites that operate across the country. So just quickly, I just want to acknowledge that the research was conducted by a team based in Edmonton, which is on Treaty 6 territory, and also traditional homeland of the Métis people. The study was funded by Health Canada via a grant through Canadian Institutes of Health Research, and also acknowledged funding from the CRC program. So as we all know, the COVID-19 pandemic, especially in North America, compounded drug poisoning risks. And we also know that people who use drugs and those with prior history of substance use disorder were particularly impacted by COVID-19 and had higher risks of hospitalization and death. So as frontline interventions for people who use drugs, we really wanted to understand how the pandemic period, the acute pandemic period, impacted Canada's supervised consumption sites. So I think everyone knows what a supervised consumption site is, so I won't go over it, but I'm happy to discuss it later. But essentially it just monitors illegal drug consumption and provides emergency medical aid and other supports and services. So the data I'm about to show you were derived from our National Implementation Science Study that is evaluating the federally exempted supervised consumption sites in Canada. And I'm going to speak to you about some survey data that we collected with 34 of 37 federally exempted supervised consumption sites implemented across the country. And so these interviews were conducted with either managers or directors of the services between March 2022 and February 24. And we did a very large organizational survey and also collected some administrative health data from them. But essentially, their services ranged in location from very large urban centers to smaller cities. They had different models of care, including embedded, standalone, or mobile. And they offered a variety of different kinds of drug consumption. So this included things like inhalation, peer-assisted injecting, drug checking, and drug splitting. So here's some data from our survey. So overall, supervised consumption services made several major changes to their intake procedures and physical spaces during the COVID-19 pandemic and in the acute COVID period in particular. So almost all implemented participant screening, required or provided PPE, had hygiene protocols, occupancy limits, and physical distancing. Often this was following broader public health directives and mandatory policymaking. Most stayed open in the same location with the same operating hours. However, 77% had to reduce their occupancy capacity and 66% had to reduce their service offerings. About a quarter of the sites reported that they reduced their reliance on oxygen and mechanical ventilation, and 34% modified bag valve mask resuscitation procedures. Most required staff did on extra PPE in responding to drug poisoning. It's really important to note as well, it's not up here, but many of these sites served critical public health functions, including by providing COVID-19 screening, testing, access to vaccines, as well as supporting people to get into isolation if they tested positive for COVID-19. The sites went through a really difficult period during this time. Most of the sites that we talked to said that it was harder for their clients to access their services during this period, especially structurally vulnerable people who use drugs. 34% reported a decrease in demand for their services, while 38% reported that they saw an increase in the number of people that they had to turn away. 35% were excluding people who showed COVID-19 symptoms at some point. And 44% of operators reported not having enough space to accommodate distancing and ensure adequate capacity. And I think some of the data we've collected in Canada so far has really shown that this was a very difficult time for people who use drugs, and many faced increasing socioeconomic marginalization and other challenges. And there was the service providers reflected this and said that they saw a big increase in requests for housing, mental health care, primary health care, basic needs and treatment. But they actually saw a huge reduction in the availability of services for people during this time, and were not able to meet a lot of those referral requests. So in conclusion, I just want to acknowledge that these there was such a period of uncertainty and difficulty during this time for the operators and the staff working in these facilities, and they were faced with an impossible challenge of having to balance access and ensuring adequate support for people who use drugs, while also trying to protect the health of clients in the program, staff, and also sometimes people were, also concerned about vulnerable family members at home. And so I just want to acknowledge the incredible emotional burden that was borne by the people working in these services, as well as the clients accessing them, and thank people that did that. And just make a few recommendations. So first, we really need to strengthen and maintain dedicated communication channels between these sites and public health officials and other decision makers responding to emergencies. Second, we need to plan and create tailored crisis response protocols so that we're not just making it up as we go along in the early phases. And these protocols obviously have to be something that can be open-ended and modified as needed. And then, although the sites were providing sustainable or critical public health functions, the majority did not receive any supplementary funding to do that. And so it's really important, if we see these as a core intervention for emergency response for a very highly vulnerable population, that the sites not just have sustainable operational funding, but also get quick access to supplementary emergency funding. So the key takeaway, these are essential public health services, and they need dedicated resources and tailored policies for emergency response. And just to acknowledge the study team, our funders, and again, those people that were living this very difficult time. So thank you.